sit down. I said to you there are total refractive power when our lens accommodated for distant object, something that far above us. As you can see here, light rays in the external part, in the external world, when reach to the cornea, bend. And after that, to the aqueous humor here, and passing from the pupil and reach to the lens. That lens also is so transparent. And there are another bending here in the lens. And finally, this structure in the front of the eye all of them can determine the refractive power, how this structure in the front of the eye can bend the light ray to focus on the retina. And here you can see this is 59 diameter. What is the diameter? The refractive surface of this structure in the front of the retina, here is 17 millimeters. This is the focal length that we have in the mirror, for example, in the physics. Okay? So this is 70 millimeter. If we divided 1 to 70 instead of millimeter, in the centimeter, we have this. And the unit is diopter. Just something against our focal length in front of the retina, that determined by what? By this structure in the front of the eye. Okay?
Can you explain it again?
Pay attention. We just won't have an artificial unit. This is artificial unit. We made this. Okay? When we want to explain about what is the power of structure of eyes for bending the lights, we said this is refractive power and has a unit, that this unit is diopter. Just this refractive power. What is the refractive power? The power of the structure of the eyes, in the front of eyes, that can bend the lights for what? Focusing on the retina. Just this, okay? The meaning is important.
When we measure the vision, we measure the refractive power.
Yes, we have a refractive power when something, for example, is far away and then it starts to come nearby. This refractive power increases. I will explain. Okay? The refractive power.
If anyone has 6 by 6, something, this is a refractive power?
Yes. Yes, we have. When you when you open your eyes, this refractive power you have, because the light pass, and after passing from the cornea, passing from the aqueous humor, passing from the lens, they bend. This is refractive power. Okay? But something important, we have two main structures in front of our eye that bend the light ray. Yes? Two main structures. What are them? Cornea, and another is lens. When we see something far in the forest part, and the refractive power is, for example, about 60 diameters. Okay, which one has more power for bending?
Lens.
Lens or cornea? Which one? Lens. But you can see here, when they reach, these rays reach to the cornea, the bending is more, yes, than lens. So cornea is more important. Please, you are the physicist. Explain why. You know, my God, you know. I'm sure, absolutely you know. But your friend said the power of the refractive power for is two main. Which one is two? We have two main structure for this refractive power. Which one can bend light rays more? Cornea. Your reference said lens. I said no. This is cornea. But why cornea? You can see here also. Why? You explained before.
Density of the
Because of bending of
medium particles for the medium.
change of medium.
Differences of medium in two sides of cornea. Pay attention. Here in this side of cornea we have A. But in the back of cornea we have liquid. So the differences between air and liquid about the density of them I talk. Density of them is so different. But what about the lens? In the front side of lens is a liquid, but in the back is a gel. The differences of them in the density is too low. That's why the bending of the light rays for something that we want to see far in the farthest part is by the cornea. So I can say 2/3 of this refractive power is by cornea. By the cornea, 2/3. I can say about 40 diopters is for the cornea, and other about 19 to 20 is for lens. But as you may know, our lens is very important, and we know no matter we want to see something far or something near, which structure help us? Lens help us. Pay attention for the farthest things. Yes, lens cannot help. But when something starts to come near to us, this is lens that help us to see it, because can change the curvature of itself. And when the curvature of itself change, the curvature increase, what happened? The power refractive of lens increase. This is important because it can change. What about cornea? This is constant. Constant. With distortion. Yes, again. I will explain. Let me show you the figure. Pay attention here. This is lens. This is lens. And you can see here lens in this section. Okay? You can see there are some ligament, and the surround of that ligament there are some ciliary muscle. Because of this structure here you can see there are ligament and they are circular fibers. When something starts to come near us, lens can increase its curvature. How? By ciliary muscle contraction. When ciliary muscle contract, what happens for this ligament? This ligament can near into the middle part, and before that they pull the lens. But when they come to the middle, the pulling of the lens get away, and because the lens is flexible more than just transparent being, they can increase their curvature. When the curvature increase, the refractive power of them can increase. And what's the meaning of that? They can bend light rays more. And after that, focusing on the retina can increase, especially on the fovea. Especially on the fovea. Okay? Here you can see. Please pay attention to this figure. As the object moves closer, here, please pay attention. Here is lens, and they are ligament, suspensory ligament that called xenoid fiber, and they are, here you can see, and they are ciliary muscle. When an object moves closer, what happens? The muscle of ciliary body contract. You can see contract here, contract, okay, and reduce the tension of the zunar fibers that suspend the lens, and the lens become more rounded and convex. Okay? So the refractive power can increase from 20 when you see something far to 34 when you, for example, want to see this. Okay? This is very important, called accommodation. So accommodation, that is changing in the refractive power of the lens, is very important function of our eyes. Something far, something middle, something nearby. You can see. Why? Because changing in the refractive power of that. I'm gonna say you the refractive power, like the papillary light reflex, controlled by the parasympathetic fiber. Both is controlled by parasympathetic fiber. Okay? But what about sympathetic stimulation? Is there any sympathetic stimulation here? No. They can relax, but not in normal accommodation. In the normal accommodation, that means you can see something far or something nearby, it's just by the parasympathetic, like the papillary light reflex. The sympathetic stimulation is just for their fight or flight. Okay? Fight or flight reaction. But here I want to show you something named presbyopia. What is the presbyopia? Pircheshmi. In Persian we say pircheshmi. What is this? Loss of accommodation of lens. And it happened for everyone when reached to which after, for example, 50,
After 40.
40, 40. When you reach 40, this happened. Loss of accommodation by the lens. But gradually progress. Gradually progress. So it happens with age, as I said to you in the from the 40 it starts, and it can be about 2 diameters in 45 to 50 years, and 0 diabetes at age 70. What's the meaning of that?
We can't see object.
You can see just
Far objects.
far objects. That's correct
Yes.
or no?
Yes.
Yes.
For example, I at least
60.
60. Hmm? How much?
You are 30, 32.
30? I'm 30.
43.
40? Someone says 60. I about 50. Okay. Okay. As you said, I cannot read this. Yes? But I can?
It will become blur, I think.
Become?
Blur. You can see, but you can't see.
No,
clearly.
no, no. It's so clear. So clear.
You can see, but you can't see.
Related to
More in
No. Nothing happened in the ciliary muscle. Something happened in your lens. I said to you, lens is flexible, can get more circular,
Convex,
round, and get flat. Yes, but for me, it's not change the diameter. It cannot change the curvature. But I can say, read. Why?
You are young.
More near. Oh, thank you. Go back. Go back.
Yeah.
Go back.
It will not change. It must be placed at the specific point, focal point.
I just read in this. And if you change, for example, here or here, I cannot change my
curvature.
curvature. It stopped, but I'm so lucky. Why? Because it stopped where I can read.
Yeah.
For someone in this situation can read. It's not normal. So they need which kind of glasses? Which kind of glasses they need? Concave or convex?
Concave convex. Concave convex.
Concave?
दोनों चाहिए.
Here they can.
They can.
And if they want here, they need convex.
Yes.
They need convex, but I
To
don't need.
converse.
I don't need. But for you, for example, if I red, you can.
Yeah.
Red, you can. Red, you can. And also here.
Yeah.
Why? Because
Curvature.
the curvature of your lens can change, but for me, no. For
It is
me,
fixed.
here is the better situation. When you go, it gets blurred. When you go back, get blurred. Because my curvature not changes. This is the exact meaning of presbyopia. That's why many individuals need glasses that are bifocal. I mean, here is convex and here is concave. For me, what is this? Here is concave because I don't see far things. But what about here? Because without glasses I can read. Here is just a simple glass. A simple glass. So this is bifocal. But the upper part is concave for seeing far, but for seeing nearby I can. And I don't like, for example, for seeing something far, wear glasses and then want to must, for example, see. I don't like. That's why I ask. I want bifocal, but instead of convex here, this is a glass, simple glass. Okay, got it? Okay. So every or each individual, when reached to the 40, the presbyopia starts. But up to your body, to your genetic, to your structure of body, the lens will be constant, but up to you it can constant, for example, for the far object or for the near object. I'm so lucky it stopped for the near object, so I can read without glasses. But more people need, if they don't need something for seeing far, they just have a convex glasses. But if they have some problem for seeing far, and because they get presbyopia, they need bifocal glasses. The upper part is concave for seeing far, and the convex for seeing near. Okay, and this you can understand. You can find that this is bifocal. Why? Because this is progressive. This is progressive lens. Gradually concave converts to the, for example, convex or simple. So you cannot understand and find this is bifocal. You think glasses like, for example, but it is bifocal. But progressive. But this is progressive. Okay. Other things that you should know about the disturbance in the lens is what? Cataract. What is the cataract? Pay attention. Cataract, as you can see here, when we speak about the lens is transparent. I can say lens is a capsule filled with a liquid and all part is transparent. And this capsule is elastic and contain of protein. Lens is transparent and is lack of any organisms. Okay. One of proteins that important in the cell cytoplasm of lens is crystalline. This can damage by what? Ultraviolet light. Dehydration. If you have dehydrated for several days, your lens can damage. And by oxidation, that happens a lot. These crystalline proteins change shape and aggregate to produce the cloudy patch. Cloudy patch on the and into the what? Lens. So if you, I can say every or each individual gets presbyopia. But what about the cataract? Someone can not get cataract if there are no damage to crystalline. Because this is something pathologic. But presbyopia is something physiologic. Some physiological aging, like losing of nephrons in our kidney. They are physiological aging, but cataract is something pathological. If you got removed from the ultraviolet light, from the dehydration, you may not get cataract. So, after getting cataract, what happened? Your lens should be removed, and replaced and plastic lens instead. That will happen frequently these days in patients in 70 ages, because cataract is a pathological condition that happens in 60 to 70. Okay, what is pathological? Other things that you should know is error of refraction. What is the error of refraction? If I can, this is an animation. I hope I can show you.
Ma'am, the function of lens is just to bend the light.
Lens?
Just to bend the light function.
Yeah.
So during this cataract, patches form on the lens.
No. The bending, nothing happen, because the curvature is the same. But
Okay, which is
usually in that age, you lost the
Accommodation.
power of changing curvature because you got first myopia, for example, 20 years ago. I said to you, this happened, cataract happened in 60, in, for example, 70. So you lost the power of curvature.
then during cataract, patches form on the lens, and the shape of lens is still same. The bending depends upon the shape of the lens.
No, the shape of the lens not changed. Shape of lens just changed by the first myopia. In the cataract, there are some patch, some cloudy patch, some cloudy particle because of the changing in the structure of protein. Protein, crystal protein, just this. For example, in this point, you can see damaged crystal protein, and that's why you may see something cloudy, just cloudy. No something error in the refraction. They are different.
Maybe it's reflection and bending is same thing.
Hmm?
Reflection.
Of the lights, if is back the retina called hyperopia, and if the focusing and gathering of light rays is front of the retina called myopia, and for the correction of them, for this hyperopia, correction needs convex lens, and for the myopia in this situation, correction needs a concave lens. I'm gonna ask you, what is the problem that many young people need to wear glasses? What is the problem? I mean, this is some problem in the lens that, for example, they are hyperopia or they are myopia or
Shape of the
shape of eyeball. Shape of eyeball. Eyeball should be round, but they are not round, and they can be a little long or a little short. So, because of changing of the length of or dimension of the eyeball, it happened. Okay, no, something happened in your lens. No, your lens is correct without any problem, but the simplest way to correct it is
Use lens. Glasses.
covering external lens. Instead of, for example, surgery on your eyeball, or for example, injecting some gel to your eyeball wall. Why something invasive? Non-invasive way is better. So, correction made by the external lens. I'm going to ask you, do you see some young people up to now, for example, in your dormitory or in your school, that wear convex lens? You?
No,
Really?
I think.
दूर क्यों नहीं होता है ना
You, so in fact, you are hyperopia. You have hyperopia.
Yes, sir.
Yes or no?
Yes, ma'am.
Yes.
You can see everything very good at far. Yeah?
No.
So you are myopia.
उल्टा
So you
है.
are myopia.
सर तो लोग मैं पे हमारे मैं पे बड़ा रोड है सर.
You are hyperopia? Yes, you are
Myopia
myopia.
is there.
When I young, I was myopia. That's why I need contact. What about others? You are myopia. What about you?
नहीं बता.
You are
I cannot see
hyperopia.
it from far.
You are hyperopia. If you not hyperopia, you cannot see me in good situation. You should see me cloudy or black. Where is your glasses?
In the back.
Please let me have. Correct what? Aqueous humor. Okay, so aqueous humor is secret by this ciliary muscle nerve, ciliary epithelium, ciliary process epithelia. Okay, where to the posterior chamber of the eye, and they flew to the what? They flew to the anterior chamber, and after that, from the canal of Schiller, they go back to the circulation.
Cannot see the pointer.
Hmm?
Pointer.
It doesn't work, sorry. Please. Because here there is no blood vessels. Because here should be transparent. So they are secret for nourishment of the cornea and iris. And because of this liquid here, there is some pressure here. What is normal intraocular pressure is 12 to 20 millimeter Hg, something like our capillary bed in other tissue. Pay attention, in normal condition, there are phagocytic system in the near the canal of Schiller for keeps trabecular space clean in the normal condition. But if there is large amounts of debris and particles in the aqueous humor, from, for example, some hemorrhage or some infection in this part, what happened? What happened? Glaucoma happened. What is the glaucoma? Glaucoma is increasing the pressure. It can reach, for example, to 25. It should be cured. Because if there is increase in the pressure here for the long time, it just be, for example, 5 millimeter Hg more, the blindness happen. So it should be treated. How you can do that? The best thing is increase the flow from the canal of Schiller or reduce the production of that. There are some drugs for this. Decrease the secretion by some beta-adrenergic blocking or some inhibitors of carbonic anhydrase enzyme like acetozolamide, and or increase the flow outflow of the liquid by some agonist cholinergic. You may heard pilocarpine, about the pilocarpine or physio. They cause ciliary muscle contraction. By ciliary muscle contraction, the outflow increase, because when they contract, the structure here, when they are ciliary muscle, yes, when they contract, this canal gets more open because they pull that, and they get open, and the outflow increase. And other thing is prostaglandin. Prostaglandin is also increased outflow. So if you cure and treat glaucoma in the proper time, nothing happens. But why increase in the increase the pressure here make individual get blindness? Why? How related to your seeing? The increased pressure here in the aqueous tunnel. How?
It can compress the lens.
Lens.
Cornea.
For example, lens compress. What happened? You cannot see, but not get blind. Blind is something different.
Light cannot pass if there is.
Please?
Light cannot pass if there is pressure.
Lacking of
Light.
Rupture of lens.
culture of lens change. What happened? You get blind? No. You cannot see clearly, but you not get blind.
Due to high pressure, rupture of lens.
Nothing to lens, nothing related to lens.
It's ciliary body.
Ciliary body? No.
Due to destruction of retina.
Please?
Due to the destruction of retina.
Ah, yeah, something happened in the retina. Why? Why something happened in the retina? Why pressure come to the retina? Why?
Because of the fluid.
Why? No, no, no. Vitreous, because when increase the pressure here, some liquid that reach to the vitreous humor increase, a lot increase, and this gel can get dense, and after that can have a lot of pressure on the retina, and after that can affect on the sending signal to the higher part of CNS.
The ganglion?
Hmm?
The ganglion of the...
Yeah, and the ganglion cells, especially the axon of them that pass from the spot light, spot point, okay, here press, and the ganglion cell will die. After that, you get blindness, okay?
Then, in this case, we remove the aqueous solution quickly. To remove the debris,
In the normal condition, the pressure, for example, if there is more
Can you-
than 3
Can you show the last slide? We increase the aqueous outflow to remove the debris.
To remove the debris, sometimes debris, but some people genetically, without any debris, may have glaucoma. We don't know why. This is essential glaucoma. But there are two ways for treatment. Decrease secretion or increase output. Just many people, we don't know why they get, because when we see the canal option is open and there is no debris there. But I can say you when one of more important symptoms of you may understand that something happened in the pressure is that you may see debris. You individually, when close your eye, you can see something move. If another break, and after that I will start energy from the external world and converting it to something that is acceptable and understandable for our nervous system. Okay? I know that you know about the structure of the, about the histology of the retina, but here I don't want to mention something about the histology. Here in the retina, I want to show you some cells, some neurons that are important, and because of these cells, these neurons, these neural cells here, retina is a compartment of central nervous system. Central nervous system, no peripheral nervous system. Okay? Here you can see photoreceptors, they are rods and cones. Two kinds of photoreceptors, I will explain about the differences between them. And after that, there are bipolar cells. Oh, so sorry, I got it. Okay, thank you. After, so they are rods and cones, and here we have bipolar cells, some bipolar cells that connect rods to ganglion cells. Here are the ganglion cells. Between them there are other interneurons like horizontal cells, like hematopoietic cells, and other cells that are not shown here. Pay attention. Why this part is the compartment of the CNS? Because there are many cells here that they have junction, they have the synapses with each other, and there are some processing. There are some processing of data here. They not just sending signals to the higher part of CNS, and after that something happened here. Something happened here in the retina. Some changing, some understanding of the light waves happen here by this junction, by these synapses here. So here retina is a neural part and very important. As you know, the first cells that respond to the light is what? Is them photoreceptors, rods and cones, both. Sorry. But pay attention, this is the direction of light. Yes, this is the direction of light. It means, pay attention, light comes from here. Come from here. You can see here, okay? Come from here, and the first cells that respond to them is photoreceptors. That they are they
Retina.
place in the outmost layer of the retina. So light rays should pass these ganglion cells, this direction, bipolar cell, and after that, when reaching to the photoreceptors in the outer segment, they can convert to the electrical energy. So they should pass this direction.
In outer layer or inner layer?
Outermost layer of retina.
Of retina. Yes.
It's innermost.
Pay attention, this is
Direction
retina.
of light.
Yes, this is retina. Yes. In this inner part, the most inner part is ganglion cell. And outer part of them is here, this part.
Direction of light.
Hmm? As you can see here, ganglion, photoreceptors, the outer segment of photoreceptors is in contact with the choroid layer. That is the middle layer of the eye. Okay? So, this is important that you know light pass this distance to reach the photoreceptors where they can respond to the light. Here. So, pay attention to this. They are, this is from another way. Okay? This is outer segment of the photoreceptors that placed near the choroid layer. Pay attention to this layer. This layer, some book say this layer is belong to the choroid layer, and some books say no. This layer, pigment epithelium belong to the retina, but no different. Okay. Here you can see a pigment epithelium between is and choroid layer. Yes? This part, this layer, this epithelium have many functions for especially seeing well. As it is clear from the name, this is pigment epithelium. Which kind of pigment? Melanin. Yes, this is melanin. And you can get the back of the eye when where the photoreceptors placed are dark because of melanin. Dark. We have dark room in the back of our eye because of this melanin. For what? For absorption of scattered light. Scattered light, because if there are some light rays that reach to, as I said, this is congenital absence of melanin all parts of your bodies. When light reaches to the retina, reflected in all directions inside the eyeball. So, impair the visual acuity a lot. Okay? So, this is very important. Another function of pigment epithelium is they have this power to phagocytosis. They shed outer segments of the photoreceptors. Pay attention. This part, the outer segments of each photoreceptor, is someone that changes a lot. I mean a lot of producing something that needs or respond to light. I will explain. I mean about the, I will speak about the rhodopsin, you may hear. And after that, the old one shedding. So, the phagocytosis of shedding outer segment of photoreceptors is very important here, because here should be clean. If there is some particle here, they can reflect light that reach here. Okay? Another function is delivery of nutrition from the blood to the photoreceptors, especially to the outer segments. This is very important function of that. Pay attention. You know, more than this choroid layer, we have central retinal artery that they nourish cells in the retina, but in the inner part of that. For example, ganglion cells, bipolar cells, and the inner part of photoreceptors. But the outer part of photoreceptors for nourishing depend on choroid layer a lot. You may hear something about the retinal detachment. What is the retinal detachment? Retinal detachment is just a little distance or a space between choroid layer and outer segment of photoreceptors. What happened? The
Blood supply
individual
stop.
get blind because photoreceptor they die. If the space or the distance between here, outer segment, and the choroid layer was more than 50 micrometer, they get die. So one of important function of them is keeping the outer segment here near to the choroid layer. So if retinal detachment may happen, retinal detachment from the pigment epithelium due to injury to the eyeball may happen. Sometimes from the contracture of fine collagenous fibrils in the vitreous humor. Something is different against of increasing pressure in the glaucoma. This is a contracture and keep them into the center, and after that may cause detachment of the retina. So this is very important. As I said, the outer layers of the retina, especially the outer segment of rods and cones, depend on diffusion from the choroid blood vessels.
Can you explain second part?
About here, about what?
The retinal detachment again.
Retinal detachment sometimes happen. What is this? This is increasing distance of retina, which part of retina, especially photoreceptor and especially outer segment. From where?
Epithelium.
Let me show you. From this part, from the choroid layer that reach of vessels, reach of blood. So, when there is, for example, especially injury or trauma to your head, for example, by accident, or sometimes fibrils in cartilage figures that we have in the vitreous humor can contract, and after that, because of this contract, they pull the retina get far from the choroid layer, and that's what when this distance, I mean this to this, is more than 50 micrometer, they cannot have enough nourishment. Okay? This is retinal detachment.
Why we need the phagocytosis of outer segment of photoreceptors?
Why we need what?
The phagocytosis of outer segment of photoreceptors.
Because, pay attention, here between cells, between all cells here, for example, I said to you, here, pay attention, I said to you, direct light can pass all parts to reach here. So if there is some particle here, they then want to reach here, they may contact with particle here and absorb them. They not reach to this part, because this is the outer segment of each photoreceptor that respond to light. And when light passes this part, if there is some particle, they can absorb and not allow reaching them to the outer segment. So they should be phagocytosis. Another function is suppression of an immune attack of the retina. Pay attention. There are many immunological molecules in the blood, and when they want to reach to the photoreceptors, these cells, this layer of pigment can suppress them, because photoreceptors are very important for us, and when our immunological molecules or immunological cells like lymphocyte, neutrophil or other attack to our cells because of, for example, autoimmune or other things, they protect our photoreceptors. And other important thing is they are, this layer, pigment epithelium, is a resource of vitamin A. You may hear about vitamin A for our vision, for better seeing, because each molecule for responding to the light needs vitamin E. Each molecule. So vitamin A is very important for our vision. And sometimes when there are deficiency of vitamin A in our body, we may have some problem in seeing at night. Shakuli, he said to that, night blindness. Okay? We need to go to the other side. Okay. Here, again, other part that I want to explain about too is about the something as nervous system we want. Receptors and neural function of the retina. What is the neural function? Up to now, I didn't explain something about how, for example, the neural cells respond. But so, because of that, our objectives are the electrical response produced by rods and cones. Other cells, what is the function of other cells that I mentioned for you in the retina, and if we have enough time, I will explain the trace of neural pathways that transmit visual information from the rods and codes, and after that other cells are here to the visual cortex. As I said to you, these are neural cells in the retina: photoreceptors, bipolar cells, horizontal cells, hematocrine cells, and ganglion cells. At first, because they are, pay attention, they are neural cells. When we speak about the neural cells, we should explain about the rest membrane potential, because they are excitable cells. Why here I should explain the rest membrane potential? Because against other neural cells that you know about that, here there is some difference between rest membrane potential of photoreceptors with each other, with other cells that you know as, for example, a neuron. Here, pay attention, each photoreceptor have outer segment, inner segment, and the other parts that have some synaptic portion for having chemical synaptic with others. But here, pay attention to this part. This is outer segment and this is inner segment. There is something here, you can see sodium current, that called the dark current, from the inner segment to the outer segment. That called dark current. What is this? This is a small fluid of sodium that depolarized the membrane of photoreceptor when there is no light. So, the rest membrane potential is a little depolarized instead of a little hyperpolarized. This is minus 14 millivolts. Do you remember about something about other cells rest membrane potential? Minus 16, minus 17, minus 19. And here you can see this is a little more positive. Minus 14 millivolts is the rest membrane potential. When we say rest, we mean in the darkness. There is no light to stimulate the cell. Okay? Here, I'm going to show you how this happens.
So they are more sensitive than other receptors. Because they have lower threshold.
More sensitive or no?
They're more sensitive than other receptors because they have lesser threshold than other.
But pay attention. When the negativity of membrane potential is more, they are more sensitive.
Yes.
But here has another story. Okay? I will explain for you. A complete difference between here and other cells. Okay? I will explain. Pay attention here, like each cell in our body. Here in the inner segment there are what? Sodium, potassium, ATPase form. Yes? That can send the sodium out of the cell, and this sodium, as I showed you this, can current from this part to this part, to the outer segment. And what happened? Depolarization of the segments. Okay? So, here, when sodium reach to this part, here in the outer segment of each photoreceptor, there are some channels. What are them? Cyclic GMP gated channels. Here there are a channel that dependent to a one nucleotide. This is a kind of nucleotide. This is not electrical. So, if there is cyclic GMP and bond to this channel get open in the outer segment. So, in the darkness, that there is sodium in this part, because these channels are open, sodium can enter the cell and make the dark current, and the cell gets depolarized. Yes? How light change the membrane potential? Because when we say they are excitable cells, they should respond to something, some energy that here is electromagnetic energy, visible light. Okay? How light change the membrane potential? Before that, you should know about the molecule here that respond to the light. What is this? They are visual pigment or rhodopsin that placement on the cell membrane, where in the outer segment. You know that outer segments have hundreds of membrane sacs or discs. Why? They are cell membrane. Our photoreceptors, for having a huge surface of the cell membrane, needs to be formed. For what? For placement of this photopigment, for the rhodopsin. Okay? In the visual pigment rhodopsin consists of what? A protein opsin and the retinal bead derived from vitamin A. I said to you, for each molecule that responds to the light, we need vitamin A, because protein opsin combined with the retinal aldehyde that called retinal or retinol. This part is derived from the vitamin A. Pay attention. When this part is in this configuration that called 11-cis retinol, they combine with the opsin protein. But when you can see this is an angle here, an angle here. But when there is light can change the configuration of these and make it straight. And after that, they are all transretinal that cannot bind by protein, and everything stops. So one photon of the light rays can do that in the rods, just one photon. And the rods start to respond. What is the response? What is the response? For example, here the light reached to the outer segment, and visual pigment rhodopsin separate from the retinal part because of what? Retinal part and opsin separate from each other because of the changing of 11 Cs to all transretinal. And after that, you can see 11 cis retinal into all trans, dissociation from the opsin. Then dissociate from the opsin called meta-rhodopsin 2. This is unactivated of rhodopsin. Okay? Unactivated of rhodopsin. What happened after that? You can see here. When meta-rhodopsin 2 activate, you can see this is in the length of the cell membrane, not in the cytoplasm. This is on the cell. All things happen in the cell membrane. Okay? Visual pigments that activate and know is meta-rhodopsin to reach to the 1G protein that called transducin. Activate this G protein. Then G protein activate one enzyme that this enzyme is in the cell membrane, is membranous, not in the cytoplasm, that called phosphodiesterase enzyme activate. What is the function of that? Conversion of cyclic GMP, if you remember, cyclic GMP in the dark bond to the sodium channel and open it. Phosphodiesterase converts cyclic GMP to the linear form, and the number of cyclic GMP gets lower. Okay? What happened? Because there is no cyclic GMP, the sodium channel closed. What happened? Cannot sodium enter. Yes? And after that, this receptor potential is hyperpolarization instead of depolarization. Other part in our body, when a neuron responds, the first response is depolarization. But here is hyperpolarization. So, the amount of rest membrane potential was less positive, less negative, minus 40. And then stimulate, now it gets more minus, more negative, and can reach to minus 70 or minus 80 millimole. In this situation, we said, oh, the photoreceptor stimulated. So, receptor potential here is, after reading you can understand. This is hyperpolarization. Accept it, after that I will explain for you. Accept it, okay? This is surprising because we don't expect. With stimulation, there is a hyperpolarization. It should be depolarization. Okay, I will explain, you get it. Okay? So pay attention, this is a summary. There are many steps for photo transduction. You can see here, if there is line, again, 11-cis retinal convert to
Trans.
all trans retinal. And after that, rhodopsin activated that part meta rhodopsin 2. Meta rhodopsin 2 make transducin, that is a G protein, activate. And after that, G protein, transducin G protein, activate an enzyme, phosphodiesterase enzyme, that convert cyclic GMP to linear GMP. What happened? Decrease the amount of cyclic GMP and the closure of sodium channels happened. What happened? Hyperpolarization in the cells. And they are cells that have chemical synaptic. Yes, they release neurotransmitter. The amount of release, glutamate release or neurotransmitter release here is decreased or increased?
Decrease.
Decrease? Yes? Yes?
Cells in middle.
Yes? Decrease. Keep in your mind up to here, okay? Or after that I will explain. But keep your mind by light and the release of neurotransmitter from the synaptic portion of photoreceptor decrease. Okay? And the neurotransmitter is glutamate that release, but the number report is decreased. Okay? Glutamate secretion is decreased.
Why not
The resting state.
By
GABA is also a inhibitor. Like
no, here is just glutamate. Here just glutamate. It's not GABA. GABA is for the horizontal cells. I will explain, okay? Here is just glutamate.
In the
But
resting state.
glutamate is a receptor.
Stimulator.
This meeting is the simulator. After that, I will show you some in somewhere like here it can be
Depending on
for
the
example
receptor.
depends on the receptor.
When there is no light, sodium channels are always open.
Yeah, sodium channel open and release of glutamate here is high in the dark.
And the meta-rhodopsin 2 is the all trans plus opsin.
Yes,
Both these two combined from this.
combine each other in the dark, but when there is the light, they are dissociated.
Man,
And-
explain the meta-rhodopsin again. Meta-rhodopsin.
About rhodopsin, what's your problem?
Like I didn't send up this across the version. I didn't understand. From this retinal to cross-retinal. Can you
Just-
explain it? Yeah, can you explain it?
I want, that's what I asked, which part is your problem, okay? Pay attention here. If retinal part that derive from the vitamin A is in this configuration, the angle in the molecule that called 11-cis retinal, they are combined and bind to the opsin part. But when there is light, this light can change the shape of molecule. Just the shape, okay? And after that they get straight instead of angle. Because of this straight, we can see here, They dissociate from the oxygen, and after that, this part can be activated. But after activation, G protein, translucin activate. After that, enzyme activate. After that, cyclic GMP is reduced, and the channel closed. Okay. But what about cones? Something that explained in the last exercise exactly happened for cones. But what is the difference between them? You can see the structure of them a little different. You can see here this is, and here this is. It shows us the membrane folding of cones is a little lower. So the number of photopigment and arch there is a little lower because the surface of cell membrane is low. So this is another important differences with road is they consist of color sensitive pigments. What is this? They have retinol and photoxin, yes? And this part of them is different from rose. These colored pigments that we have as a human, at least we have 3 different photoxin here, at least I say. One of them is blue sensitive pigment. Blue sensitive pigment. They respond maximally in this amount, 445 nanometer. Maximum response is here. Pay attention. They can respond from here to here. But the maximum response is here. Another is green sensitive pigment. The maximum response is here, 535 nanometers. But there are a range of response of them. Another is red sensitive pigment. The maximum response is 570 nanometers. Pay attention to this. Only one of these 3 types of color pigments is present in each cone. So in each cone we just have 1. No, for example, 2 or 3. Each individual cone have just one of them, blue or green or red. Okay? So we have 3 different kinds of cones. Okay? Here I wanna give you mention to what is our interpretation. Interpretation is important for us of color in the nervous system. Pay attention to this figure. When you say, for example, I see the blue color, I see the green color, I see the yellow color, I see the orange color. For example, when you see the blue color, or green color, you expect just, for example, green cones excited. No, our interpretation from the color is something different. Pay attention here.
Mixing.
For example, I can say the ratio of stimulation of all three is important. For example, for the blue color, your system interprets if the stimulation of green cone was 0, red cone was 0, but blue cone was 97. The typical blue. But about the green color, your system interprets if the stimulation of red cone was 331, blue was and green was 67 or something green. So the ratio of them understand by our central nervous system, not just by one. Combination of them is important. I mean, for example, for blue color, if you don't have, for example, green cone, for seeing something blue, do you have problem or not? You have, because these kind of signal should reach to nervous system. Nervous system, wait for here. If there is nothing from that, it's another interpretation. Pay attention. Okay, I will show you. And for the yellow color, you can see 83% stimulation of the green and red, but about the blue is 0. And for orange, you can see 99% of red stimulation, 42 of green, and 0 for. What is the color blindness? I want to show you here about that. You know, color blindness is a congenital lack of 1 or 2 or maybe 3 of kinds of cones. Most commonly, it happens in either L or red or M or green cones. So, producing red-green color blindness. Why this is so common? Because the gene for these two cones located on X chromosome. So what happened? Because men have just one X chromosome, this color blindness can happen in 8% of men, but for women just less than half. Because women have 2 X chromosomes, and if one of them has problem, another one compensates. So pay attention. These are women that transfer the gene, the damaged gene to their boys, their son, not your father. Okay? What? Yeah. Pay attention to this. If you see 74, you are not. If you see 21, you can be red green color blind person.